Good day everyone, my name is Josh Clarence Pilagos. I'm a student nurse for today. For today's video is we're gonna doing um, the the NCB, which is the newborn care. So we will start the demonstration. So newborn care defines as the management of PLA. Of course, it is also the subsequent period of the stabilization. So before we start the assessment, we need to wash our hands prior to prepare our materials needed, such as gloves. So right now I'm using gloves, and um, also the vitamin C, K and I and C, and also the forceps. We have the forceps and the syringe. And since we don't have a clip, so I use the rubber, and also the wipes. And so give the infant comfort by keeping the environment warm to prevent the heating loss, and also to prevent it may cause the hyperthermia. So before we start the assessment, so by knowing the infant, you just need to check um, his on his arms, which is the so by determining the infant patient, so we just need to check the wristband and the name, check the name, and also the birthday of the patient. So before we're going to start the assessment, we need to wash our hands and prevent the spread of the microorganisms, and also to avoid the cross contaminations. So I'm done washing my hands, and also I'm done to use the gloves. So now let's go to the patient's room, to the patient's room. So now we're gonna clean the cord of the patient, and we're gonna do the 3 times. This card. This card. Go. So after cleansing the cord, use the umbilical clip 1 to 2 inch from the base of the cord. So since we don't have any clip for the cord, so we're using this rubber to use for use the cord. So just like that. This is the 2 inch for the cord of the patient, so like that. And after this, cut the cord about 5 cm above the cord clip, and express the remaining blood from the cord with the OS, and place on the base of the cord. So clamp the cord for remaining cord, and then pinch the remaining blood like this. And we're going to so we're done. So we will remain like this into 3 minutes to prevent the anemia, and also the intramuscular bleeding. So after that, cut the cord about 5 cm above the cord clip, and express the remaining blood from the cord with the OS placed on the base on the cord. So like this. So so now we cut. So now we're going to cut the cord about 5 cm. So place OS at the base of the cord stump, and pour 70% of ROH over the cord. So after that, place the OS on the base of the cord, stomp, and pour 70% of ROH over the cord. So just like that. So these ROH will help to prevent the patients, the infant, to hurt. So just like that. And after that, starting with the head. Starting with the head, circumference, chest, circumference, abdomen, circumference, and the newborn's length. So now we're gonna draw the exact amount of vitamin K from the optic tubing injects into the middle of the third lateral aspect of the infant's thigh. So after that, starting with bed circumference, chest circumference, and abdomen circumference. So take the newborn's temperature rectally, and also after taking we're gonna wait when the temperature going to sound beep. So I think we're done. So the temperature is just normal. And after that, holds the newborn in a football dreamer, folding both ears. So after that is we're gonna hold the newborn in a football grip manner, folding the both ears. So we're gonna fold the both ears. And after that, carefully washes the newborn's head with the use of baby soap or mat. So we're gonna use the soap. And we're gonna wash it. So just like that. And after that, so wraps the newborn securely with a clean blanket. So here it is, the baby. We're gonna going to scrap the baby with the blanket, and also place the newborn baby in the crib with drop light and the touch a screen tag application for kids for free access. Place a newborn in the crib with drop light on the touches crib tag application of prophylaxis. So since we don't have any crib, so as saying, we're going to lay down the baby here. And after that, shades newborn's eyes from light and open one eye at a time by exerting gentle pressure in the upper lower lids. We're gonna check his eyes. And that's okay. And next is exerting gently pressure on the upper lower lids. And next is apply ophthalmic ointment from inner to outer canthus, making sure. So we're going to apply ophthalmic ointment from the inner and outer canthus with the pressure. After that, take the tip of the medicine tube, will not touch the eye of the newborn, and takes the newborn's vital signs. So we're gonna take the newborn's vital signs. So we're gonna take the newborn's vital signs. So we're gonna take the infant's vital signs. And does aftercare and records the procedure done and the other patient's data and answer related questions for the procedure. So we're done the procedure and assessment for the newborn care. So that's all.